Aloha guys, Dr. Tom is coming back. He's here. He's happening. He's with it. Okay, we're going to study Unit 4, Chapter 4, the metric system. The metric system, guys, is the unit of measure used by most of the world. We use the English system in America, so us and the English and a few others, but the rest of the world uses the metric system. The scientific and medical communities use the metric system, as does the United States military. Okay, basically, guys, it doesn't say this anywhere that I saw, so let me just throw it out here. There's three basic things you need to know about the metric system. The unit of length is measured in meters. Unit of volume is measured in liters, like a 2-liter Coke. And measure of weight is measured in grams. Now, those are the three basic types of measurement. There's a number of ways to subdivide them down smaller or larger. For example, your car travels in kilometers. A kilometer is 1,000 meters because a meter is not small enough to make, it's too small to be a value in clocking the speed of a car, for example. So that's why it's in kilometers, or it's pronounced kilometers. Okay, medication dosages may be in micrograms. Micro is a millionth of a gram, and a gram ain't much, guys. In milligrams, a milligram is 1,000th of a gram, or in grams. And then this is often determined in per kilogram of body weight. So I don't like the way they just jump in here without explaining. I still follow the old military tradition that I learned many years ago, is present the overall view and then start working into more detail. Okay. The volume medication, remember we said volume was in liters, is often in milliliters, a thousandth of a liter. How big is a liter? Well, it's half of a 2-liter Coke. Other measurements, blood pressure is measured in millimeters of mercury. How high it'll push mercury on the tube, although most blood pressure cuffs nowadays don't use mercury. Some still do. Wound and lesion size measured in centimeters. Centimeter is 1/100th of a meter. How long is a meter? A little longer than a yard. Organs are measured in grams. Laboratory results are often measured in micrograms, a millionth of a gram. Micro means millionth. Milli means 1,000th. Grams per deciliter, or units per liter. Okay. Whole numbers designated by Arabic numbers. What are Arabic numbers? The ones that we know. 1, 2, 3, 4, 14, 36, So people who don't like Arabs and all, well, you're using their alphabet and their not their alphabet so much, their numeric system. Decimal fractions are used for numbers less than 1. Prefixes are written lowercase. Abbreviations are same for singular, plural. Okay. The language of the metric system uses 14 prefixes. Yes, they do, but there's only 2 or 3 or 4 that's used a lot. Each prefix is based on multiples of 10. Now, guys, I'm going to tell you the secret to the metric system. The metric system is a superior method, and the reason is everything is in units of 10, which means to convert things, all you got to do is move the decimal point. See? In other words, in the English system, there's a 12 inches in a foot, and there's 36 inches in a yard, and there's 3 feet in a yard, and there's 5,280 feet in a mile, and 1,760 yards in a mile, and see what? Everything in the metric system, guys, is neat in units of 10. Medical field uses 7 of the most common. Micro is a millionth, milli is 1,000, centi is 100, deci is 10, deca, hectare, and kilo. Then from there it starts going bigger. Deca is 10, 100, kilo is 1,000. So all you got to do to convert is just move the decimal point. Infinitely more easier than the English system. But the problem is, I still like the English system too, because I was born into that. That's what I learned, Of course, I had a lot of metric system training in the military and in the medical training, college. Meter is the fundamental unit of length. 1 meter is 39.37 inches. Okay? How big is a yard? 36 inches. So a meter is 3.37 inches longer than a yard. 1 inch, you need to know this, is 2.54 centimeters. A centimeter is a 100th of a meter. You take a meter sticks about like a yard, chop it into 100 pieces, that's a centimeter. So an inch is about 2.5 centimeters. But you need to, I would for sure learn that. Okay, now here shows you some conversions between the English system and the metric system. A liter is a little bit bigger than a quart, 1.056. It's about a fourth of a gallon. Why? Because it's almost a quart, 2.1 pints. I don't know that this is necessary for right now. You got enough to worry about. A liter is the fundamental unit of volume. 2-liter Cokes, 2 liters. 1 milliliter of water, that's how it's abbreviated, equals 1 gram in weight. There's 5 milliliters in a teaspoon, 15 milliliters in a tablespoon. Now these two I wouldn't have known. Well, you don't normally have to do it, but sometimes. A gram is the fundamental unit of solids and mass, or weight. 1 gram is the weight of 1 milliliter of water. Milliliter is not much. If you took a 2-liter Pepsi, cut it in half, that's a liter, and chopped it into 1,000 pieces, that's a milliliter. Grains, don't worry about that. I wish they wouldn't put that in here yet. That's not often used. It is some. Okay, so 2.54 centimeters is an inch. 1,000 milliliters is a liter. We know that because milli means 1,000. 1,000 micrograms is a milligram, yeah? Or a million micrograms is a gram. 1,000 milligrams is a gram. Okay, we know that. 1,000 grams is a kilogram. Yeah. 1 kilogram is 2.2 pounds. So you need to know this one, because you're going to have to be converting between a little bit. There's not a lot of this, guys. It's very simple math, so don't worry. No algebra and stuff much. It's all simple, but 1 kilogram is 2.2 pounds. So a kilogram is just a little more than a half a pound. Conversion set up a proportion using metric equivalence. Assign x as a value of unknown factor. Solve proportions learned in Unit 3. Now, if you're making calculations within numbers that are within the metric system, guys, all you got to do is move the decimal point, man. If converting from larger to smaller, multiply by 1,000, which is the same as moving the decimal point 3 places to the right. If converting from smaller to larger, divide by 1,000, which is the same as moving decimal places 3 to the left. Now, this would be you're going milli and kilo. I mean, you could do it by, they are not always 1,000. That's what I'm trying to say. It makes it read like that's the case. Some medications are ordered as milligrams per kilogram. So when that's the case, you got to convert the patient's weight from pounds into kilograms. How do you do that? You divide it by 2.2 right here. Weight of the patient must be expressed in kilograms. Divide the weight in pounds by 2.2. Why? Because there's 2.2 pounds in a kilogram. So if a dude weighs 160 pounds, divide this number 2.2 in kilograms, he weighs 72.7. Then it's the number of milligrams per this. Hopefully you understand. Now there's going to be some problems like using this, so you need to get this down here. Dosage according to kilogram body weight. Convert weight to kilograms. That's what we just did. Calculate dosage based on the weight. Determine number of doses per day. Calculate amount of medication per dose. That's if there's more than one per day. Sometimes there are. Okay, that's it, man. Now that's a real quickie rundown of the metric system, but it's enough to get you what you need for this. Okay, introduction. Let's see what's the medication order, Unit 9. Given for a specific patient, written by a physician or authorized prescriber, such as PAs or nurse practitioners, must be legible and complete. There's electronic medical records and the electronic health record. Medical record is the individual patient's. Health record is a national database about the patient, so other doctors can see. Electronic software programs that have a prescription component. Yeah, they do. Full name of patient, name of medication, generic is preferred, so it's ibuprofen rather than Motrin. Dose and route, frequency of administration, date and time written, specific directions, signature of prescriber. If illegible, unclear, or incomplete, will not be carried out. Order must be rewritten or clarified in writing. Prescriber or covering provider will be contacted. That's if they can't read it. Now, guys, doctors are famous for having terrible handwriting. I don't know how these pharmacists sometimes can But I guess if they have to, they just have to call over and say, Doc, what is this? Okay, now this is just the way it's done. It's just rules. So it's acceptable to write out microgram or abbreviate microgram like this. You write out units, you write out days or doses. In other words, you don't put a U and try to make it an abbreviation. You put a leading zero before a decimal like this. Unacceptable, you don't use this symbol for microgram. You don't use a U for unit. You write out the word because it says so right here. You don't use a D for dosage or days. You write them out. And you don't put a trailing zero after a decimal point. It's understood that there's a zero there, but we don't write it. But we do write it here. So you kind of need to know those guys. That's why it's just customary. It's custom. Prescription is considered a legal document. 8 parts to a prescription. See Figure 9.2. Definitely check that out. They don't have it here in the PowerPoint. It's in the book. Purpose is to control the sale and use of drugs safely and effectively. 2 main classes: prescription drugs that you got to get from your doctor, or over-the-counter, which you can waltz into the pharmacy and buy them and take it out. Prescription, dangerous power habit forming, used under physician supervision. Over-the-counter, OTC, you need to memorize that right now. Approved for use without medical supervision. A lot of drugs were once prescription and eventually have been allowed to be OTC. Like, I always make fun of Larry the Cable Guy. Prilosec OTC. You can go out to that county fair and eat like a damn pig, and when you start having acid reflux and you think you're going to die, you can take Prilosec and keep right on eating like that. I grew up in the South, guys. I had a belly full of that crap. No pun intended. Electronic or e-prescribing. E-prescribing uses online computerized software to create and sign prescriptions. It's more and more of that, of course. Used by all healthcare providers. 2 parts. Part 1, two-way electronic communication between physician and pharmacy. It's not a fax or paper. Part 2, potential for information sharing with other healthcare partners. Prescription refill. Full name, date of birth, phone number, medication, pharmacy. Give patient approximate time you'll call back. Check the patient's chart. Give request to physician. Notify patient. Other types of medication orders. Verbal order. You won't see too much of that. Telephone order. You call in. P&R, as necessary. This is an important abbreviation, guys. That's what it means. As required or as necessary. Routine order. Prescribed, detail, and single order one time. Stat order. The word stat is real important. Anytime in healthcare, in a hospital or doctor's office, you hear stat. That means stop what you're doing and go do whatever they're needing because it's an emergency. Immediately stop talking to your baby daddy and get it in gear and get over there and see what it is they need. Guides for understanding medication order. Become knowledgeable about drugs your physician prescribes. Obviously, if you're working for a psychiatrist and he's prescribing all kinds of stuff for female vaginal disorders, something ain't right. So it depends on what kind. Probably when you work in family medicine, you'd see the broad, primary care, broadest base. But if you work for an eye doctor, ophthalmologist, chances are there's only a limited amount of meds that doctor is going to prescribe. Write each verbal order exactly as heard. Repeat back to the physician. Understand order completely before administration. Ask any questions before administration. If in doubt, seek assistance. Be familiar with the new drugs on the market. The pharmacy reps will keep you up on that, man. Medication label, brand, generic name, NDC number, dose strength, frequency, administration route, warning, expiration date, lot or batch code, special instructions. I'm moving because I want to try to get done. Abbreviations, shorthand in the medical field, international language, clear and concise means for writing orders. Many abbreviations, symbols, and dose designations can be misinterpreted. Reported to ISMP. Let's see, look at table 1.9, abbreviations and their meanings. There'll probably be a number of those guys that are important. You need to for sure do that. Don't skip over reading the textbook. That's one of the biggest mistakes you can make. Unit 15, antibiotics. Microorganisms, 4th leading cause of death in human beings. 100 plus years ago, it was the leading cause until the accidental discovery of penicillin by Alexander Fleming, and they developed modern antibiotics from that. Now, of course, like everything else that mankind messes with, they've messed it up because they use too much of it, and it's caused a lot of problems. Microorganism, 4th leading cause, 50% are virus related. Do I have to say COVID-19? Agents include bacteria, fungi, protozoa, rickettsia, and helminths, which are worms. Okay, we're running out of time. We're about to end. Dr. Tom will see you the next one coming up next.